Cerebrospinal fluid rhinorrhea is defined as the leakage of CSF into the nasal cavity due to a breach in the barriers of the skull base. According to A.K. Ommaya's classification from 1976, the etiology of CSF rhinorrhea can be divided into three major categories: traumatic, non-traumatic, and idiopathic causes. Let's explore these in detail. Traumatic causes account for the majority of CSF rhinorrhea cases, approximately 80%. Accidental trauma, such as fractures of the skull base, often involving the cribriform plate, is a common cause. Iatrogenic trauma from surgical interventions, such as transsphenoidal surgeries for pituitary tumors or sinus surgeries, can unintentionally lead to CSF leaks. Penetrating injuries, though rare, such as gunshot wounds or stab injuries, can also result in direct disruption of the skull base. Non-traumatic causes are less common but significant. Congenital defects, including developmental abnormalities like encephaloceles or skull base malformations, may predispose patients to CSF leakage. Erosion by pathology, such as tumors like chordomas, meningiomas, or invasive nasal carcinomas, can erode the bone and dura, causing leaks. Infections like osteomyelitis may also play a role. In idiopathic cases, no clear underlying cause can be identified. This condition is often linked to spontaneous intracranial hypertension or thinning of the skull base over time, commonly seen in obese middle-aged women. The pathophysiology of CSF rhinorrhea involves a breach in the skull base, disrupting the dura mater and arachnoid membrane, creating a direct communication between the subarachnoid space and the nasal cavity, leading to the characteristic clear nasal discharge. Persistent leaks can increase the risk of life-threatening complications such as meningitis. The diagnostic approach includes testing for beta-2-transferrin, a CSF-specific protein, which is a diagnostic cornerstone. Imaging modalities like high-resolution CT and MRI can precisely localize the site of the leak. Management of minor leaks may involve conservative measures, including bed rest and lumbar CSF drainage. However, persistent or high-flow leaks often require surgical repair, commonly through an endoscopic transnasal approach using tissue grafts. Understanding the etiology of CSF rhinorrhea based on A.K. Ommaya's classification highlights the diverse origins of this condition, emphasizing the need for prompt diagnosis and tailored management to prevent complications.